Chairman, members of the board. Thank you for allowing us a little time this morning to speak to you. I represent Alleghany Memorial Hospital. We have 15-member board of trustees, 13-member foundation board, all of whom donate their time and energies free of charge to support the hospital, try to make it the best that we can make it. After looking at the financial statements for the months of January and February, our board felt that it was important that we inform the county of our cash position. And I gave Chairman Richardson a call in February to schedule a time to meet and make that information available. I have sat in your position for a lot of years. I think this is the first time I've been on this side of the table. I'm not sure which one's the easiest. But we are here today because we strongly feel that we should work together as a community to maintain Alleghany Memorial Hospital for now and future generations. Our CEO recently resigned, and we are now in recruitment process to fill that position. We have a little PowerPoint slide presentation to make, and we have our admin group here. And if y'all would just raise your hand, John Spencer, our Human Resources Officer, Katie Woodle, who's the Finance Officer, and Wendy Orton, who is Nurse Supervisor. They'll present in just a minute, but before they do that, I want to make just a couple points. We believe that physician recruitment to this area is a big part of the solution for moving forward. We have recently partnered with Appalachian District Health in our proposal to Golden Leaf for funds to continue this recruitment effort in our area. Dr. Jack Kahn will soon be retiring. Dr. Murphy has left. We lost Dr. Ray a couple years ago. So physicians are really, really important. We want to express to you our appreciation for your previous funding through the revolving loan fund so we could recruit Dr. Joe Arosha. That has been critical. Also, hopefully, due to the fact that you funded $100,000 in this year's budget for recruitment, we think in the near future we'll have an announcement to make on another position coming to our area. But physician recruitment is the key, in my opinion. When practices are closed to patients, patients go to other areas or down the mountain for primary care, or they come to our emergency room, and that contributes to $1.5 million a year in charitable care that we have to shoulder. So I think point of care dictates which hospital is referred and where the care is administered. If we have primary care physicians here that our community can see, then the likelihood of them being admitted to our hospital is greatly improved. And it solves a big piece of the puzzle. But I want you to be aware of the challenge. Recruitment has changed. You know, the days of having a Dr. Jack Ashley or Dr. Cy Raleigh or Dr. John Cavachi that wants to work all the time. They come out any hour of the night and work on weekends, do rounds in hospitals. That's not there anymore. What we're seeing are physicians that want to work, but they don't want to manage a practice. They want you to manage their practice. They want you to guarantee them a salary. And they want a 3-year contract with a 60-day out. And that's what we have to do. That's what we have to work with. And all this costs money. I wish it were different, but it's not. So I want to just go ahead and let our team come and present their slides, and now have a couple comments at the end.
Good morning. Good morning. My name is John Spencer. I'm the Human Resource Officer for the Alleghany Memorial Hospital and a member of our senior management team. On behalf of our hospital, again, we would like to thank you for allowing us to come before you to make this presentation. Today, we would like to talk about some of the challenges being faced by healthcare today, by Alleghany Memorial and hospitals across the country. And everybody in this room knows that we have been facing tough economic times in this country for the last several years. It's impacted individuals, businesses, governments, and it's been especially challenging to healthcare. And a lot of that has to do with the way we're reimbursed. Hopefully this will come up here in just a minute. Yes. Okay. But because of the poor economic condition that we're facing here in the county and throughout this country, hospitals have seen an increased number of uninsured self-pay patients. And again, when someone comes to our doors, I mean, we're going to triage them and provide care appropriately. And for somebody who can't pay, of course, we don't want to let that stand in the way of them receiving quality care. But again, it kind of puts our finances in a bad place because they are unable to pay for their bills. And again, this is because of the high unemployment rate that we have throughout the country. And of course that leads to, because we're serving so many self-pays, it leads to the fact that we're seeing an increase in charity care and bad debt amounts. We're seeing increases in the number of Medicare and Medicaid patients that we're providing services for. Looks like we're just about there. Okay. And again, this increase is due in part to the growing number of uninsured in our service area and just by the general aging of the population. Government programs where we get most of our money from in regard to claims are reimbursing us below cost. And another one of the challenges, of course, is physician recruitment. And we believe that physician recruitment will make a big difference in our bottom line for the future. If you look at the operating margins of hospitals around the country, it's interesting to see that when you look at critical access hospitals, only 32% of critical access hospitals across the country are showing positive margins in 2011. And only 68% are showing negative margins. And when you look at all the hospitals throughout the country, only 45% are reporting positive margins on their bottom lines, you might say, and 55% negative margins. And this information is taken from the cost report system And a cost report is a report that is sent to Medicare, and it is done by every hospital throughout this country annually. Over the last number of years, hospital management has had to make some very tough decisions about our service model, about services to maintain and maybe services to let go because they don't really fit into our core model. And we've had to make some tough choices to lower our cost as far as our delivery of care. As in 2004, we transitioned our CAP program to a local community provider. Therefore, we were able to maintain those jobs for those former employees, and we closed our adult daycare program. In 2004, we discontinued our OB service. In 2005, we converted from a system called Prospective Payment System to Critical Access Designation. And when you look at a Prospective Payment System hospital and a Critical Access, the only difference is in the way we get reimbursement. We get a little bit better reimbursement through Critical Access Designation, and they limit us to 25 beds. We've also introduced new revenue-generating services over the last few years, like sleep lab, mobile MRI, pain clinic, orthopedic surgery, with our surgeon coming up from New Chatham and doing the procedures once a week. And in January of 2011, we implemented the hospitalist program. And this was, the hospitalist program is kind of like a nationwide trend, because we have fewer and fewer physicians and localities who want to round on their patient in the hospital. And that forces hospitals to pay for those services that in the past were done by family physicians. As far as the state of Alleghany Memorial Hospital, as you can see here, we were down slightly on acute patient days in 2011, and again, this is read from left to right. Swing bed days, we saw an increase. And again, swing bed is the in-between care from acute to going home, or being able to go to a rehab facility or something like that. Observation days were up significantly. ER visits were down a little bit compared to 2010. Lab tests were a little bit down, but pretty steady compared to the last 2 years. Total x-rays, again, about the same as 2010. Number of CT scans were down a little bit to 1,989 compared to 2,116. Number of mammography scans was about the same as 2010. Rehab units, we saw an increase over the last year, and this is one area where we feel like that we can provide a very valuable service to the community. And also in OR minutes, we've seen an increase, 53,435 compared to 44,547 in 2010. For fiscal year 2011 that ended in September of last year, the hospital's gross revenues from all payers totaled a little over $18.8 million, and our net revenues totaled a little over $10.8 million. And you might think, well, what's the big difference there? Well, it has to do with our reimbursement. Because of laws and guidelines and negotiated contracts, and where most of our revenue is coming through Medicare and Medicaid, and we are forced to, by law, to discount and to write off, we were able to only collect 58 cents on the dollar, and that was down from 62 cents on the dollar that was collected in 2009. Our expenses total a little over $12.4 million, and that includes our net bad debts, costs for supplies, salary and wages, and employee benefits. But one key indicator that we monitor is the equivalent expense and that is the sum of our inpatient admissions and estimate of our volume of outpatient services. And when you look at net bad debt, that's defined as charges that we have had to write off because we weren't able to get payment within a standard time frame. And in fiscal year 2011, it was over $1.1 million. And again, a lot of this is self-pay, and it's people who can't pay their bills. For this year, for fiscal year 2012, it's annualizing out at about 1.6 million, which, as you can see, is a significant increase. Now, some things we put in place to try to improve these numbers is we've implemented upfront collections. Nobody likes to pay upfront for services, but we found that we needed to collect more from our customers upfront for the services that we provide. And we collected about 37% of the possible collections in 2011. And this year it's running about 43%, so we're making progress there. We also have agreements with 3 collection agencies to help us to collect on charges that are owed to the hospital. But to temper that, we do have in-house advisors to where someone who's having a hard time paying their bill, who wants to know what their co-payments are going to be, can go to that advisor and they can help them with their out-of-pocket responsibilities. As far as supplies and drugs, that was a little over $1.2 million for fiscal year 2011. And some of the things we put in place there to help save on our cost is the utilization of our group purchasing contract through Quorum Health Resources, where we realized the savings of over $106,000. And we're currently participating in the 340B drug pricing program that helps us about cost of medications for outpatients. It sets a limit on how much we pay there. As far as other expenses, we spent over $265,000 on utilities, and most of that, of course, stayed in the county. And our travel and education was almost $11,000. And again, this is mainly for staff who need to go off-site to receive additional education because, as you know, healthcare changes. New procedures, new medicines, new ways of looking at providing health care. So we want to, it's not a huge amount, but we do want to give our employees the ability to go off-site to get additional training. As far as expenses go, we work with Skyline to consolidate our phone and fax lines to reduce our costs there. And we have sought and received funding through the Rural Health Care Program of the Universal Service Fund, which helps us on our utility bills. And this is a fund that is also made possible, made accessible to the local schools as well. We've used a lot of free educational offerings through GPE and through the Hospital Association and through the QHR Learning Institute, where the programs that were offered there through our contract with QHR showed a savings of over $10,000. As far as wages and salaries, for fiscal year 2011, our salary cost was something over $4.5 million. And over the last 5 years, we've only been able to give one pay increase, one merit increase, which averaged around 2%. So as you can see, if you look at our cost, our labor costs compared to our net patient revenue, it comes out to be about 42.9%, and the North Carolina average for critical access hospitals is almost 49%. So we do have a lean workforce, and cost cutting is something that we've worked on for the last 6 or 8 years. As far as benefits, we paid out over $794,000 in paid claims for medical and dental prescription for our employees and their dependents, and over $314,000 that actually came back to the hospital. Over $248,000 for administrative fees, and that's since we're self-funded, we must have a third-party administrator who does our billing for us. And we have to have a network where we can get discounts as far as what the cost of healthcare is, and we have to have reinsurance for our large claims that go over. We've actually raised our, what's called the stop loss level to where it's $90,000 to give us a better cost for reinsurance. We utilize a broker to get us the best deal that we can find as far as networks and reinsurance companies. And we've increased premiums paid by hospital employees over the last 4 years. As far as productivity, we use productivity guidelines that are national benchmarks to establish our own benchmarks for efficiency. And we chose the 90th percentile, and again, 100th percentile, as you well know, is the best you can do, or the best is being reported. So all of our standards are set at the 90th percentile, with some of our departments at minimal staffing, where you just have 1 or 2 people or employees in a department. And we hold our managers accountable to their budgets. And they have to develop budgets annually, and they're held accountable to their staffing levels and to how much they spend. And because of our efficiencies that we've put in place last year, we saw savings of over 8,000 hours under our benchmark, and that equated to over $176,000 in savings. One key operating metric that we're proud to be able to share is our cost for providing care. And if you will notice there, our cost is about $4,976 per discharge. So if you compare that to the national average of critical access hospitals across this country, we're better than the 75th percentile. So we do provide care at an efficient cost, and that's one thing that we've tried to do over the last years. That brings us to the question, why do we need a hospital? Well, it's obvious that we need to have local, timely access to emergency care. And there's a number of people probably in this room could stand up and give a testimony to the care that they received here at Alleghany Memorial, and that they're here because of that. Our own public reporting that we have to do to CMS on a regular basis shows that our patient satisfaction scores are on the same level as national and state averages. And we have a company that measures patient satisfaction called Avatar, and over the last 5 years we have received 5-star rating from that company each year. We need the hospital because not only because we have and are able to provide quality care, but hospital is needed to be able to attract new businesses and new residents to the county. We're the employer of highly skilled workers and professionals, and we provide jobs for local people. Local students have gone to college and received their degrees in healthcare. So that brings us to our request this morning. Without assistance from the county, we're going to have a hard time with capital investments, physician recruitment. We just don't have the resources anymore to pay for the uninsured population here in Alleghany County and the areas we serve. So our request that we're bringing before the county commissioners today is for $50,000 per month, beginning in July 2012, which will be your new budget year, I believe. And we base this number on the cash loss, or the reduction in cash balance for the first 4 months of this current fiscal year, which was $198,839. And in conclusion, I would like to share this with the commissioners. You know, Alleghany Memorial has been and continues to be a major player in the health and wellness of the citizens of this county, as well as the economic health. And we've been here for over 61 years, providing care and providing services. And by granting this request for assistance, you will help ensure that this hospital, Alleghany Memorial Hospital, will continue on providing quality care for our community back over to Mr. Tate.
Mr. Taylor, give Ms. Evans just a moment to get set back up.
I'd like to thank our admin team for putting this together. They did all this work without the help from any CEO in-house, so they worked hard on it. I'd like to leave you with a math problem. If you're good at subtraction, you can figure this out, figure out my age. I was born in 1949. And I can't remember in my life a time when this county didn't have a hospital. It's been here all the time that I can remember. All my family members have benefited from time to time from having the hospital here. I was driving down the road this morning, I bet I could talk 30 minutes on different instances when my family has benefited from the hospital. I want to follow up on the health department's presentation about health and well-being. I remember from history class in high school, they talked about 3 modern characteristics of modern society. And that's health, education, and welfare. I don't know how much you've thought about that, but we can't allow our county to regress back to the 1940s. We can't go back. I'd rather not even think about it. I'd like for us to move forward and do the best we can with what resources we can muster and provide the best health care that we possibly can for our community. Again, I thank you for your time. I know this has been a little bit lengthy, but it's a very important situation. Thank you so much.
I will declare a 5-minute recess while we have a chance to give the hospital a chance to remove their